Good afternoon, everyone, and welcome to another Facebook Live Lunch and Learn with the Center for African American Health. COVID numbers continue to spike across the nation and in our very own state. We hope that you and your loved ones are taking all precautions necessary to stay healthy and safe because COVID is a real thing. Please also consider how your Thanksgiving plans can be modified to reduce the spread of the virus to friends and family. The CDC recommends that you don't host or attend gatherings with anyone who has COVID-19 or has been exposed to someone with COVID-19 in the last 14 days. I know many people are creating virtual Thanksgiving meals. They're going on Zoom, creating plates of food, and then sharing their meal with their families and their friends. So be creative. We're just waiting a few minutes for people to tune in, and then we'll get started. So while we wait, I'm going to go on and introduce myself. I am Yolanda Gotier, and I am the Senior Living Health and Wellness Navigator for the Center for African American Health. And essentially, in a nutshell, that means if you are 50 plus, come, call, participate in our series of classes that allow you, borrowing a phrase from Jill Scott, to live your life like it's golden. We want to make sure every day is a golden day for you. And for those of you who may be unfamiliar with the work of the Center for African American Health, we have been in the community for over 20 years, and we are providing information and education that is community-based, evidence-based, looks at disease prevention and disease management. We have programs, events, and lots of services. Currently, we are not receiving participants in our building due to the COVID-19 restrictions, but you're always able to go to our website at caahealth.org to learn more about our work and our programs. This month has been a month like no other month ever in the history of our country. The news of the election commanded most of our attention, so there are many who may not know that November is National Family Caregivers Month. And to celebrate this month, we want to honor and recognize the vital role of caregivers in addition to raising awareness of some of the challenges that they encounter. Now more than ever, caregivers need our emotional support and access to resources due to unpredictable and uncontrollable nature of the current crisis that we are all facing with this pandemic. So many of the things that we may have used or resources that we just may have been able to go to, they're just not available right now. My next guest joined me earlier in this year in July on Facebook Live, and I am so excited to have her here again today. This has been an amazing partnership, and I have learned so much from the information that she has shared, as well as from her 2 books, and she will always carry a special place in my heart. So I would like at this time to introduce Nadine Roberts Cornish, who is the founder of the Caregivers Guardian, an organization dedicated to empowering and inspiring caregivers to create a process that will allow them to tend to their loved ones while managing their own needs. So with that, I say welcome back, Nadine. And if you wouldn't mind, please sharing your background and giving us an overview of the mission of your organization for our viewers who are unfamiliar with your work in the community.
Okay, well, thank you so much, Yolanda. I am so glad to be back. And wow, July was the last time we were together in this platform, and this is timely with it being National Family Caregivers Month. So thank you for having me. So for those of you who don't know me, I am a certified senior advisor. I'm a gerontologist. I am an author and a national speaker. As founder of the Caregiver's Guardian 11 years ago, that really came about as a result of my personal journey, 15 years of caring for my mother. So it was my own personal journey that was the catalyst for me launching the Caregiver's Guardian, a support services organization for family caregivers. And that really, I often say that caregiving chose me. I didn't choose it. And you know, life has a way of kind of corralling us into our purpose. And my experience in caring for my mom was the evidence of what, you know, God's greater purpose for my life was. And so literally for the past 11 years that the Caregiver's Guardian has been in existence, I've been privileged to support families across the country and helping them to navigate their caregiving journey, and most importantly, to ensure that the caregiver takes care of themselves in the process. And so our mission is to serve, but to ensure that the caregiver survives the journey, and not just survives the journey, but thrives throughout the journey.
Okay, well, thank you so much. So I'm going to begin with our first question. The theme of Family Caregivers Month this year is caregiving in crisis. Caregiving was already a significant challenge, and the pandemic has added an additional level of complexity. Can you please tell us more about the 10-10-30 campaign that you launched in response to the COVID-19 pandemic?
Okay, yes. So in August of this year, I knew that I had to do something different. I couldn't do what I normally do for caregivers during the month of November. Normally, I go to New Orleans, and in conjunction with Antoine's restaurant, we host a major event for caregivers. I knew that travel was really off the plate at that point. And so I really wanted to be instrumental in creating something that would shine a spotlight on caregivers. And truly, the 10-10-30 campaign, 10 random acts of kindness and 10,000 books to caregivers in 30 days was what dropped in my spirit. And after a few days of playing tug of war and resisting that vision, I really got a piece after talking to 3 amazing PR firms from around the country, all Black women who had a vision and a heart for this project. They said yes, and we rolled up our sleeves and began conceptualizing what the 10-10-30 campaign would be. And the foundation of it is random acts of kindness, because face it, who doesn't love a random act of kindness? Mm-hmm. And human nature proves that it is one of those things that when you experience it, you want to pay it forward. You want to do something nice for somebody else because someone unexpectedly did something nice for you. And so the random acts of kindness is the foundation of the campaign. And along with the random acts of kindness are ideas and concepts that we have on our website that include pampering items for caregivers. We have virtual spa parties that are happening for caregivers all throughout the month of November, and now are being moved into the month of December. There are many caregiver packages that are available, and most importantly, the books, information, inspiration. And it's not just the caregiver prayers in my gumbo and tears in my gumbo that are part of this campaign, but we have 3 other books as well, including Family Strong by Michelle Michelle Adams, which is the amazing book about family legacy. We have I Choose Me by Cynthia James. And last but not least is Jesus in Shorts by Laura Paget. So we have ideas and suggestions for any person out there who's got a caregiver in their life that they want to support, that they want to encourage. And we've got the tools right there that you can simply purchase. We absolutely encourage you to come up with your own ideas and your own thoughts about what it is that you can do for the caregiver in your world, because that is what is most important.
Thank you. So now, what specific things are you witnessing and hearing from individuals who are trying to sustain their family unit during these difficult times?
So for every caregiver, it's different, right? Because their situation and their circumstances are different. I'm fortunate to host a Calling All Caregivers support group meeting that happens every Monday at 3 o'clock Mountain Standard Time. Caregivers from across the country call in, and for an hour, we address their specific issues. So based on, for a while, last month especially, one of the biggest challenges was the caregivers that were concerned about the fire threat that was happening on top of a pandemic, on top of socioeconomic challenges. You had natural disasters happening. That was a real problem for many of our caregivers, and providing support and encouragement and just letting them know that we were there for them. We would pray with them and really help them with some practical ideas and solutions around how to prepare for evacuation, and so it's really, really interesting. It's based on where you are and what your specific circumstances are. But isolation tends to be a common denominator for most of the caregivers. And for those of you who are listening and you have a caregiver in your world that you have not been in touch with, take this opportunity to reach out to them, because yes, they are accustomed to doing what they do, but they really need support. And oftentimes they will not ask for that support because they don't feel like they should have to ask for the support. So we are inviting those of you who are supporters of caregivers in your world to take the initiative, reach out, pick up the phone and actually call and talk to them. Find out what it is that they need. Find out what it is that you can do to support them, because your support makes a huge difference in their ability to continue doing the job of being primary caregiver.
Okay. So one other question along those same lines is, how do you consult with people who are dealing with anxiety-provoking situations, like being unable to restock a loved one's medical supplies and leading the homeschooling charge?
So that's huge. First of all, let's take the first one, right? Dealing with the anxiety that is almost anxiety for a lot of people has become a partner in this whole pandemic process, right? And so because self-care is the tenet that we really, we set the foundation of all of the work that we do on, it really is about making sure that each caregiver has a strategy around self-care first and foremost. How are you moving throughout the day? What are you doing to make sure that you are taking care of your body? You are moving your body. Are you walking? Are you getting out of the house? Are you taking time to go and sit in the backyard or sit on the porch, just to change the energy and shift the energy that you are experiencing? What are some of the things that you love to do that you're able to do within the home? And how can you prioritize and make that a priority? And so we start there, because you have to start with yourself in order to address the issues of anxiety. Tapping is another technique that during the pandemic we've introduced our caregivers to. And tapping is just like what it sounds like. And I'll give you an example of it here. This right here is an example of tapping. And this very simple movement is instrumental in helping to shift energy, calm your nerves, and give you an opportunity to restart. Deep breathing exercises are another instrumental tool in terms of shifting and reducing anxiety. Prayer is also a number one factor and highly recommended factor around reducing anxiety. Sometimes we take everything and put it on our shoulders and forget that we've got a source greater than ourselves that can handle whatever is going on, right? Okay, now the other thing you asked about was medication. When it comes to medication, if you are having challenges getting your medication for whatever reason, the squeaky wheel gets the oil. And by that, I simply mean you got to make some noise about it. You got to contact your health care plan provider to get answers around what's going on around that. Talk to your pharmacist so that you can have a direct pipeline to what's happening if there's some shortage or what have you. A lot of people have their prescriptions delivered on a quarterly basis through the mail. Reach out to your provider and get answers. Don't sit back and wait. Call and advocate on behalf of yourself, advocate on behalf of your loved one. And then the final question you asked was children, having children at home. That are now being homeschooled, that are restless, etc. I think it's really important to engage and invite the children to participate in the caregiving process. Young children are great at creating artwork, and they can be responsible for creating cards and messages of encouragement for their loved one who's being cared for. They can also create fun and inspirational messages for the caregiver as well. Getting them involved so that they understand that they're a part of the process and that what they do matters. Also that their behavior matters. And good behavior goes a long way in helping their loved one feel better. Bad behavior goes a long way in helping everybody not feel good, right? And then older teenagers and what have you, they certainly are challenged in this experience. I had a young man share with me that as a result of the pandemic, he has fallen in love with his grandmother. And he said that if the pandemic had never happened, he would never have had the time to just talk to his grandmother. And not only is he talking to her, he's learning so much about her. He's now recording her history and making videotapes of her. And he's having a blast doing that. And this time has been so precious because this young man decided, I don't know if it was intentional from the very beginning, but he started having conversations and realized there was so much he didn't know about her. He wanted to know about her, and he started recording it. So that's probably one of the best things that I've heard about, kids being home and the whole caregiving experience. We can make it a positive experience if we decide that we want it to be a positive experience. I think mindset has a lot to do with it.
Absolutely. One of the other questions, it has become increasingly difficult for people to find true refuge, emotional healing and support due to the pandemic. And I know that you have spoken about prayer and then asking people for support, but what are some additional things that caregivers can do to mitigate the feelings of isolation?
So I think the support groups are really an important facet. And now, as a result of the pandemic, many people are accessing virtual support groups. So whether it's, if it's specific to your loved one's illness, I always encourage that. If you're caring for someone who has a form of dementia, the Alzheimer's Association literally has a virtual support group happening literally every other day that you can tap into. And now, because there really are no barriers anywhere in the country, so literally every day there are support groups happening. specifically related to the illness that you may be dealing with. The support group that I host on Mondays at 3 p.m. Mountain Standard Time, that's specifically for the caregiver. That is a support group for the caregiver. We're not really talking about what's going on with your loved one. We're talking about what's going on with you, the primary caregiver. And that's where the emphasis is. And that kind of nurturing and support goes a long way. I have people who will not miss the support group call for anything. They will pass up on some really nice opportunities because the support group is so important to them, because there's no other place where they can go to be heard and supported. And so finding a support group is essential. Tapping into, I always share this, and I'll take just a quick second to do so. Excuse me. I'm pulling up my calendar, and I'm gonna show you my calendar here. Let's see.
Yes.
Okay. So I'm going to show you a month at a time, and I'm showing it to you because it's a color-coded calendar. Can you see that?
Yes.
Okay.
Now I can.
Okay, so it's a color-coded calendar, and I don't know why it's not showing as well as I want it to. Okay,
Yes.
There we go. That's a color-coded calendar, and you see that the most predominant color on my calendar is red because that's my color. That means me time on my calendar. And I invite anybody listening to color code their calendar and make themselves the priority on their calendar. When you look at your calendar at a week at a glance or a month at a glance, and you're using your colors for that represent me time, that's a really great visual that shows you that you either are or are not making yourself a priority on your calendar, and you're the only one that can do that. And so that goes a long way in terms of helping people have a visual and a conscious acknowledgement of what they are doing for themselves and what they're not doing for themselves.
Great resource. Let's talk about honoring boundaries and caregiver guilt. What do you say to someone who is having difficulty carving out time for themselves and creating me time? And I know you just talked about the calendar and doing all that, but sometimes we hear that information and we're like, yeah, I'm going to use that. And then that's all we do with it is hear it, but don't do anything. How do we just move beyond that guilt of taking time for ourselves?
I always say that guilt is something that does not belong to you. Guilt is, that's baggage you picked up along the way, but it's not baggage that you have to carry. Okay. There is no guilt and no shame in taking care of yourself. Yes, some of us have culturally and based on our familial upbringing, we have been led to believe that we have to put others first, et cetera, et cetera. But the reality is that if we don't put ourselves first, then we're not going to be around to take care of the person that we're sacrificing so much for. Self-care must come first. It really is non-negotiable, and reinforcement, hearing that over and over and over again, Yolanda, is one of the things that help you shift from the idea. We know the idea and we know that it's something we should do, but we don't put that into action. You talk to me once a week, or hop on that call on Mondays, or let's just touch bases on the regular, and we will get past that quick, fast, and in a hurry, because I will not allow a caregiver that I work with to continue to carry that baggage, because that baggage does not belong to them.
Okay. The other big thing that is happening is that families are not only working, but they're also schooling children from home these days. And I know that you've given us some ways in which our youth can help in the caregiver role and assist the caregiver, but do you have any other creative ideas to help? I know one of the things that we do is with our younger kids, we have them playing games like Connect Four or Guess Who,
Mm-hmm.
um, with with our for them their grandmother, and
Mm-hmm.
so and their great grandmother. So how many other suggestions do you have?
So the games are great, and whatever the family games are, that makes it even better, right? The game time, the time spending together, talking, just simply talking, but also that special show, whatever that special show is. You know, for some families, it's This Is Us. For other families, it's Grey's Anatomy. Whatever that is, right? That's family time, and kids get to make a big deal about it. And you know, if they're put in charge, then again they have responsibility and they have ownership around the fact that this is the thing that they are responsible for. I think that it really is important to have children engaged in the caregiving process, to be a part of caring for their loved one, even if that caring for them is simply sitting, spending time with them while the primary caregiver is off doing other things that they need to do. But it is a family effort. It is a community. It takes a village to care for a loved one, just like it takes a village to care for a child.
Okay. So, and our final question, because we're running out of time here,
Of course we are.
what advice can you offer to caregiver families and in general on creating a safe environment this year to celebrate Thanksgiving?
So, for every family, once again, it poses a whole different scenario. I always say start with love. If you start with love, then you're operating from love, then you're going to make the decision that's best for everybody. We are not going to, it's not recommended that we come together in the big groups that we're accustomed to coming together in. And that for a lot of people that's really hard. But the bottom line is that we want our loved ones to be around for Christmas. And so, in ensuring that that happens, we need to do everything that we possibly can to ensure that they are safe and they are well. And if you've been out there and you have not been adhering to the guidelines by CDC of wearing a mask all the time, washing your hands, etc., and you've been around a lot of people, then being around your elderly loved ones, and particularly, or any loved one who may have an underlying health condition and may be at greater risk, then you owe it to yourself first and foremost, and certainly to them, to simply stay away, as hard as that might be. But if you do, and if you are going to come together as a family, then please practice social distancing, wear your mask, make sure you're constantly washing your hands, and just be as safe as you possibly can be under the circumstances. My family, and particularly, we have decided that we're not going to come together as we normally do, and we're going to be doing a Zoom giving, and we're going to all have a good time doing that. And more of us are going to be able to come together because we're all in different parts of the country, and so we're going to do that and just be grateful and thankful for what we have and what we're able to do safely without putting anybody at risk.
Okay. So before we end, I want to make sure that our viewers have the link to the 10-10-30 campaign, and that link is tcgcares.com/ the 10-10-30 campaign. And with that, we need to wrap up. And again, thank you so much, Nadine, for joining us. It has been awesomely wonderful, as always. And I would like everyone to know, our viewers, that we're going to be taking a break from our normal Facebook Live schedule in observance of Thanksgiving. But we invite you to join us on December 3rd to learn more about our staff and how we are expanding our efforts to reach community during these unprecedented times. And so with that, Thank you again for listening and for being one of our viewers. We wish you and your family not just a safe Thanksgiving, but a safe every day. And so please be reminded to wash your hands, practice social distancing, wear that mask, and in case I didn't remember to tell you, wash your hands, wash your mask often,
Yes.
and wear it after it has been washed and dried. So thank you ever for being with us here at the Center for African American Health. And goodbye, everyone.
Bye. Thank you.